The smell of disinfectant in the hallway of St. Catherine Medical Center was so strong that Emma Carter swore she could taste the metallic taste on her tongue. It was the kind of hospital that appeared in news reports and TV series. Marble in the lobby, huge screens displaying donations, a mural with photos of famous surgeons, and a trauma ward proudly called the Center of Excellence. Behind the glass doors, however, excellence always came mixed with haste, ego, and that invisible hierarchy that everyone pretended didn't exist. Emma had been there for 17 days. 17 days trying to fit in. 17 days hearing her own last name pronounced in different ways by people who barely looked at her name tag. She adjusted her hair in a bun and pulled the elastic band of her wristwatch up onto her wrist bone. It was still early, but the emergency room was already buzzing. The bright light reflected off stretchers and monitors, and the constant sound of beeps and voices seemed like a sea. Emma walked with the clipboard pressed to her chest, breathing deeply and mentally repeating the triage protocol as if it were a prayer. Carter. The voice came from behind, drawn out, with the laziness of someone who knows they will be obeyed. Dr. Nathan Caldwell, trauma surgeon and star of the hospital, approached in his impeccable lab coat and with the easy smile he reserved for cameras and wealthy families. For Emma, the smile was always a smaller version, almost a practice. Run. Yes, doctor? He glanced at her name tag, as if trying to remember where he'd seen that name before, and concluded it wasn't important. You're the new one, the new nurse, right? Yes. Registered nurse. Emergency unit. Great. He pointed to room 3 without slowing his pace. There's a patient there insisting he's in excruciating pain in his toe. If he tries to convince you to order morphine, just don't. Say it's anxiety, or that his toe needs therapy. You know how to handle this kind of thing, don't you? His laughter came even before he finished the sentence, and 2 residents who were with him laughed too, a little too loudly. Emma felt the heat rise to her face, but maintained a neutral expression. Understood. Caldwell walked on, already forgetting about her, and Emma continued to the nursing station. The head nurse, Brenda Lawson, a woman in her 50s with a sharp gaze and a folder always in hand, was typing frantically. Good morning, Emma. Good morning, Brenda. Brenda wasn't warm, but she was fair, and at St. Catherine's, fairness was already a miracle. Today is going to be tough, Brenda warned without looking up. There's a delegation arriving late this morning. Government security, helicopter, probably a VIP. Dr. Caldwell is getting cocky because he likes to be seen with important people. Don't interfere. Just do your job. That's all. Emma nodded. Understood. She heard what Brenda didn't say. Don't draw attention to yourself. Don't give them a reason to. Don't be an easy target. Emma knew what it was like to live among egos that seemed like loaded weapons. In the inside pocket of her uniform, she carried a small folded card, crumpled from being opened and closed so often. It wasn't a lucky charm, but sometimes it served as one, a copy of an army discharge order with black and white lines and a seal that still looked like it had desert dust on it. She didn't show it to anyone. It was like a past life she had locked away in silence. The first alarm sounded at 9:23. Trauma on the way, entry in 5 minutes. The phrase blared from the loudspeaker, and suddenly the rhythm of the emergency room changed. Stretchers were lined up, equipment pulled out, doors opened. Emma changed her gloves, put on eye protection, and positioned herself near the entrance, alongside other nurses. Is that a helicopter? Someone asked. No, ambulance, replied a paramedic who rushed inside. Car accident. 2 patients. Emma focused on the first. Patient, a young woman with a bleeding scalp and confusion. She asked quick questions, assessed pupils, requested intravenous access. The work was familiar, almost comfortable. She leaned on it, and for a few minutes, the world made sense again. Needs, actions, results. When the case was referred for a CT scan, Emma returned to the station to fill out paperwork. That's when the strange sound pierced everything. A deep, distant noise, like repeated thunder. The floor trembled subtly. Someone opened the glass doors, and a cold wind rushed down the corridor. "The helicopter," said Brenda, already standing. Outside, through the glass, Emma saw the landing pad at the far end of the parking lot. A black helicopter descended like a shadow, kicking up dust and leaves. People in suits and headsets moved in formation. Two men in federal security jackets pointed toward the emergency entrance. Emma's heart tightened, as if an invisible hand had closed its grip on her chest. She didn't know why. Maybe it was the sound of the propellers. Maybe it was the way the men moved, disciplined, alert, without hesitation. It was the same body language as outside a base, the same energy as when something serious was about to happen. "Everyone to position," Brenda ordered. "Trauma rooms 1 and 2. Carter, you stay with me in triage, and for God's sake, follow the instructions to the letter." Emma nodded. "Yes, ma'am." The doors flung open. A team of soldiers entered first. Camouflage uniforms, under jackets. Behind them, 2 air service paramedics pushed a stretcher carrying a huge man strapped in and covered with thermal blankets. His face was pale and sweaty, and there was a bloodstain under the bandage on his side. An oxygen tube was attached to his face, and the portable monitor beeped irregularly. "Man, 58 years old," shouted a paramedic. "Penetrating wound to the right flank, drop in blood pressure during transport, severe abdominal pain, possible internal bleeding." Emma approached. The man had short grey hair and a firm jaw that still seemed hard even in his weakness. His eyes were half open but alert, as if he refused to fade away. "Who is it?" whispered one of the residents, his eyes widening as he saw the security guards. "General Thomas Hargrove," someone replied in a low voice, as if saying the name too loudly would be an insult. Emma didn't recognize the name at first. She wasn't into politics, but the way the people around her reacted, the way Dr. Caldwell suddenly appeared like a moth drawn to a spotlight, made it clear that this mattered. "I'll take it from here," Caldwell said, already snapping his gloves off. "Come on, everyone. Room 1. I want an ultrasound now. 2 large-bore IVs. And who are you?" The question hit Emma like a stone. Caldwell looked at her, finally for real, as if he had only now noticed a new piece on the board. "Nurse Carter, doctor. Triage," she replied. "Okay, Carter. Stay out of the way. I need experienced people here." Emma felt the humiliation like a cold blade. There were nurses who had been there less time than her and who wouldn't hear about it, but she swallowed hard and stood her ground. "Yes, doctor." The stretcher entered trauma room 1. The room filled with voices, commands, the sound of the ultrasound machine, and the intense light on the general's body. Emma stood to the side, ready to help, but practically invisible. "Pressure?" Caldwell asked. 90 by 55, falling," replied a resident. "Tachycardia, 120, rigid abdomen, probable bleeding. We're going to the operating room. I want blood type and cross-section, transfusion." "Where is the vascular surgeon?" "Coming soon," someone said. Emma watched the general. The skin on his face had that damp sheen of someone losing volume. His lips were dry, he was breathing heavily, and his large right hand was trying to grip the blanket as if it were a rope. Brenda approached Emma and murmured, "Keep an eye on things. If you notice anything off script, tell me, but don't interrupt Caldwell. He hates it." Emma nodded, her eyes fixed on the monitor. The ultrasound showed free fluid, blood. Caldwell felt reassured and was already chanting orders. Then Emma saw something that didn't seem to fit. The monitor showed his oxygen saturation fluctuating, and the general's chest rose more on one side than the other. It was subtle, but it was there. His breathing seemed asymmetrical. She looked at his neck. The jugular veins seemed fuller than they should be, considering he was hypertensive. Emma took a step closer. The paramedic had said it was a flank wound, but the bandage on the side of her abdomen was at an odd angle, as if the object had entered and moved upwards, and there was a purple bruise forming under her right collarbone, almost hidden by the blanket. She remembered a sound, a texture of dust, a night when a soldier breathed as if the air were glass. "Dr. Caldwell," Emma said, her voice steady despite her racing heart. "I'm sorry, The right side of your chest seems to have reduced expansion, and the jugular veins—" Caldwell turned his face slowly, as if someone had knocked over an expensive glass. "Are you trying to teach me how to examine a patient, nurse?" The residents paused for a second. The room seemed to hold its breath. Emma felt the urge to recoil, to remain silent. That's what she'd been doing since she arrived. But the monitor beeped again, and the general made a choked sound beneath his mask. "I'm just observing," she said. "It could be tension pneumothorax. The pressure is dropping and—" Caldwell gave a short, incredulous laugh. "Pneumothorax? He's got blood in his abdomen, Carter. Fluid free on fast. Let's go to surgery. If you want to play doctor, go to medical school." One of the residents laughed nervously, as if it were safer to laugh than to remain silent. Emma looked at Brenda for support. Brenda hesitated. That split second when someone decides whether to fight or protect themselves. And like almost everyone else in that hospital, Brenda chose survival. "Carter," Brenda said softly without looking her in the eye, "just do what he asked." Emma felt her stomach drop, but she also felt something older, stronger, the stubborn refusal to watch someone die out of pride. The general put his hand to his chest, as if feeling increasing pressure. His breathing became faster and shallower. The monitor showed a sudden drop. 44. 20! Someone shouted. "He's going! Start compressions?" Caldwell moved, finally alarmed. "Prepare the transport. Presser. Let's go!" Emma didn't think. She just acted. She pulled the stethoscope from around her neck and pressed it against the general's right chest for a second. The sound was almost non-existent. On the left side, air flowed better. She looked up. "No right vesicular murmur," she said. "Doctor, he has a tracheal deviation. Look." Caldwell glanced quickly. The trachea seemed pulled, almost imperceptibly. The general turned grey. "Damn it," Caldwell muttered, his ego opening a crack to reality. "Thoracostomy kit, now!" The seconds turned into a knife. The resident searched for the kit, his hands trembling. Emma had already grabbed the tray of needles, opened the package, felt the plastic tear with a snap. She positioned the thick needle in the second intercostal space, remembering the anatomy as if she were in the desert. She remembered the instructor shouting, remembered the blood and sand and the feeling of being the only person there. "I can do it," she said, looking at Caldwell. "Now." Caldwell hesitated. His gaze swept over her face as if trying to decide whether it was insolence or competence. The pressure from the monitor answered for him. "Go ahead," he said curtly, "but if you puncture it—" Emma didn't hear the rest. She inserted the needle firmly, felt the resistance, and then the air exploded with a hiss. The general's chest seemed to expand more freely. The monitor stabilized slightly. Color slowly returned to his face. The general's eyes widened, and for the first time he looked directly at Emma. There was something in his gaze that wasn't that of a patient looking at a nurse. It was recognition. It was as if he were seeing an old photograph over her face. "Angel," he whispered, his voice hoarse beneath the mask. "Angel." Emma froze for a second, as if an electric current had run through her bones. She hadn't heard that nickname in years. "General, breathe," Caldwell said, regaining control. "We're going into surgery." The stretcher was pushed out. Emma stood there for a second, feeling the world spin around her. The whistling of air escaping from the needle still seemed to echo in her ear. Brenda grabbed Emma's arm and pulled her aside. "What did you do?" Decompression," Emma said, still trying to catch her breath. "He was tense." Brenda pressed her lips together. "You saved his life." "I only did what was necessary." "You did what Caldwell didn't want to hear." Brenda let out a breath, as if she'd been holding it in for years. "Do you know what that means?" He's going to destroy me," Emma finished with a bitter smile. Brenda looked at her for a second, and in that look there was something like respect. "Maybe, but not today. Today, you stay with me." Emma returned to work as if on autopilot. The following minutes were filled with common cases. An elderly man short of breath, a child with a high fever, a man suffering from intoxication, shouting profanities. But inside her, everything was trapped in that whisper from the general. Angel. She had been Angel in another life. Not Angel 6 as a formal radio call sign, but Angel as a nickname, given by bleeding men who she kept alive with small hands and great stubbornness. She had never asked for that name. And then, when the world collapsed in a certain valley in Afghanistan, she had tried to forget. This surgery lasted for hours. The news spread through the hospital like wildfire. The general had been stabilized. He was alive, and Dr. Caldwell had done a masterful job. Emma heard people repeating this and felt a strange taste in her mouth. She didn't want credit. She wanted it to have ended the minute the air left his chest. But nothing at St. Catherine ever ended like that. In the early afternoon, Brenda received a message and signaled to Emma. "Caldwell wants you in the conference room." "Now?" Emma's stomach clenched. "Why?" "Because he is who he is," Brenda replied, with a look that said, "Deal with it." Emma walked down the corridor to the surgical ward's conference room. The atmosphere was cold, with a long table, leather chairs, and a whiteboard. Inside, Caldwell stood with his arms crossed. Beside him were two residents, the chief anesthesiologist and a hospital administrator, a man in a suit with a blank smile. "Ah, there she is," Caldwell said. "Nurse Carter, take a seat." Emma sat down, her hands in her lap to hide her trembling. Caldwell began bluntly. "Let's talk about what happened in the trauma room. You took an action that was not within your scope of practice." "Doctor, Don't interrupt," he cut in. "You decided, on your own initiative, to inject a needle into the chest of a VIP patient, a general, with federal agents at the door. Do you know the legal implications of that?" The administrator cleared his throat, as if rehearsing to sound important. "The hospital values protocols. We cannot allow—" Emma took a deep breath. She knew how that game worked. She'd seen versions of it in the army too, just with different uniforms. "I asked for permission," she said, looking at Caldwell. "You said, do it." One of the residents looked away. Caldwell squinted. "I said that because the situation was critical," Caldwell replied. "But you created this situation by diverting attention, insisting on improbable diagnoses. You almost delayed the transport for surgery." Emma felt the anger rising hot and clean. "The patient was dying. I saw signs of tension pneumothorax. I spoke. You laughed. I confirmed the absence of murmurs, and then I acted, with your permission. If I hadn't acted, he would have stopped breathing." The administrator raised his hands theatrically. Calm down. Nobody is saying you didn't want to help. We're talking about hierarchy, about communication. You know, nurses sometimes get carried away." Emma looked at him as if he were a small, annoying thing. "I wasn't excited. I performed a procedure I was trained to do." Caldwell raised an eyebrow. "Trained where? In what rural infirmary did you learn to stick a needle in someone's chest?" The phrase came with a venom, and the resident stifled laughter, staring at the table. Emma felt the crumpled card in her pocket as if it weighed a ton. She could tell. She could show it. But she had promised herself she wouldn't use the past as an excuse. She just wanted to be a nurse, a professional, no myths. "I'm certified in advanced trauma care," she replied simply. "Ah, certification." Caldwell smiled slightly. "Everyone's certified now. Still, you're not a doctor." The door to the room suddenly opened, and everyone turned around. Two federal security men entered first, scanning the space with hard eyes. Behind them, a woman in impeccable military uniform, her hair tied back, entered with a rigid posture. And leaning on her came General Thomas Hargrove. Emma stood motionless. The general was pale, with a bandage visible beneath his hospital gown and a chest drain attached to his side. He seemed more frail than she had expected, but there was a stubborn strength in the way he walked, as if refusing to fall was part of his DNA. Caldwell jumped to his feet, a smile already poised. "General, what an honor. I didn't expect to see you on your feet so soon. How are you feeling?" The general did not answer immediately. His eyes scanned the room and landed on Emma. She felt the air grow heavy. "Who is she?" the general asked, his voice low and firm. Caldwell blinked, surprised. That's Nurse Carter. She was in the trauma room. She helped with the preparation. It helped, the general repeated as if tasting the word. He took another step and, even in pain, stood upright as tall as he could. The woman beside him tried to hold on, but he raised his hand, asking for space. Emma felt a lump in her throat. She didn't know what was about to happen, but she knew it would be big. The general took a deep breath, his chest aching, and then did something that seemed impossible in that context. He placed his right hand on his forehead in a clean, formal gesture, like someone who knows the weight of a uniform, and in front of Dr. Caldwell, the administrator, and the residents, he saluted Emma. The silence that followed was so absolute that Emma could hear her own blood in her ears. "General," Caldwell began, laughing, nervously, as if it were a joke. She's just a nurse. She is the reason I am alive," the general said, without taking his eyes off Emma. "And she is not just nothing." Emma felt her face burning, her eyes stinging. "Sir, I know you," the general continued, "not by name, although I know it now. I know you from what you did in Coast 7 years ago, when I was a colonel and my convoy was ambushed. You were there." Emma froze. The walls of the room seemed to move away. Suddenly, she saw a cloudless sky and dust rising in clouds. She heard dry gunshots, screams, the sound of breaking metal. She felt the warmth of blood on her gloves. "I didn't," she tried to deny reflexively, but the general wouldn't let her. "You were in an improvised outpost. I was brought in with shrapnel and a collapsed lung. 2 doctors from the detachment had been evacuated. No one could stabilize me. And then you came in, your uniform covered in sand, and said, 'Look at me, sir, breathe with me.' And you performed a procedure on my chest with hands that didn't tremble. You kept me alive until the helicopter arrived." Caldwell's mouth fell slightly open, as if someone had turned off the light in his world. The general continued, his voice growing warm. "You spent the entire night with the wounded. You cut off soldiers' boots, applied tourniquets, held the hands of men who thought they were going to die. And when one of our own, a 19-year-old boy, began to go into shock, you slapped him in the face and told him he wasn't allowed to die that day." Emma felt tears welling up. She remembered that boy. She remembered his name. She remembered the way he had laughed at dawn when he realized he was alive. She also remembered what happened 2 days later when the world exacted a price. The general looked at the others in the room one by one. "And now I come in here and hear you mocking her. I hear words like playing doctor. I see laughter. I see vanity. And I wonder, what kind of doctors are you if you can't recognize competence when she saves a life right in front of you?" The administrator swallowed hard. The resident stiffened. Caldwell tried to regain control with a fake smile. "General, with all due respect, we were only discussing protocols. St. Catherine has standards, and I, of course, am grateful for the work of the entire team, but invasive procedures require—" "You laughed at her when she pointed out a diagnosis you ignored," the general interrupted, his voice sharp. "You nearly killed me with your pride." Caldwell opened his mouth, but nothing came out. The general looked at Emma again, his face softening slightly. "What's your first name?" "Emma," she managed to say, her voice small. "Emma," he nodded, as if keeping the name in a special drawer. "You were called Angel on the field, weren't you?" Emma closed her eyes for a second. "Yes, sir." "And you hate that nickname," the general said, as if remembering details. "Because you used to say you weren't an angel, that you were just a nurse." Emma let out a short laugh, almost a sob. "Yes, very well," the general said, and there was something like hardened tenderness in his voice. "You are the definition of service, and I refuse to see service treated as inferiority." He turned to Caldwell. "Doctor, you're good at what you do. I saw that today. You controlled the bleeding, you performed a complex surgery. I respect skill, but I respect character even more. You need to learn to listen." Caldwell swallowed, his ears turning red. "Yes, sir." The general turned to the administrator. And you need to remember that this hospital doesn't exist to preserve reputations. It exists to save lives. If anyone here tries to punish this nurse for doing the right thing, I will personally ensure that every donor and every congressional representative knows. I don't like threats, but I like injustice even less. The administrator nodded too quickly. Of course, General. We value the team, no doubt about it. This was a misunderstanding. It wasn't a misunderstanding, the General said coldly. It was contempt. The silence returned, heavy. Emma felt her legs trembling. Part of her wanted to run away. Part of her wanted to disappear. And part of her, a part she had buried in sand, wanted to stay there and accept that perhaps she didn't need to shrink to be accepted. The General took a deep breath, grimacing. The woman beside him touched his arm. "Sir, you shouldn't stand for so long." "I know," he replied, without taking his eyes off Emma. "But I needed to do this." Emma stood up slowly, unsure exactly how to act in front of a general who had just saluted her in a conference room. "Thank you," she said simply. The general nodded. "You don't owe me anything. I owe you." He paused and his eyes became more human. "Are you all right? Have you been receiving help?" Emma swallowed. She knew what he was talking about. Not the career, the life behind. She searched for words. "I'm trying." The general nodded, as someone who understands the magnitude of trying. "Keep going. Don't let them silence you or turn you into a statue. You are a person, Emma. Remember that." He started to turn to leave, leaning on something. Before crossing the threshold, however, he stopped again and looked at Caldwell. "Oh, and one more thing. When someone alerts you to what they're seeing, you don't call it a joke. You say, 'Thank you.' Understood?" "Understood," Caldwell replied, his voice low. The general left. The door closed behind him with a soft click. For a few seconds, no one moved. Then Caldwell let out a breath, as if he had been holding it since the beginning of the day. He looked at Emma, and in his gaze there was a mixture of humiliation and irritation, but also something Emma recognized, the discomfort of someone who realizes they've made a mistake in public. "You could have mentioned that," he said, pointing vaguely into nothingness, as if saying army was dirty. Emma looked at him calmly. "I tried to mention the diagnosis." The residents held their breath. The administrator made a move to intervene, but then changed his mind. Caldwell clenched his jaw. "Anyway, the general, he was clear. No one will punish you." Emma didn't smile. "That's not what I was asking for." Caldwell frowned. "So, what do you want?" She thought for a second. What did she want? For years, she had thought she wanted invisibility, that she wanted a simple, clean life, without memories. But there, after seeing a wounded man stand up and salute, she felt that the void inside her was made of something else, of recognition not as a medal, but as humanity. "I want to do my job," she said. "And I want that when I say something important, someone listens. Not because I'm a symbol, because I'm here, because I see things, because I care." Caldwell was silent for a moment. Then he nodded, almost imperceptibly. "Right." Brenda, who had entered unnoticed, touched Emma's shoulder and pulled her outside. In the hallway, Brenda let out a humorless laugh. "Did you see his face? If I had a camera..." Emma took a deep breath, feeling her whole body tremble now that the social danger had passed. "I didn't want this." "I know," Brenda said, more softly than Emma had ever heard her. "But sometimes, Emma, the world pushes you onto the stage, and you can't stay in the dark forever." Emma swallowed. "I'm not a hero." Brenda looked at her, serious. "You saved a general's life today, and from what he said, you've saved lives before. You don't need a cape, but you also don't need to diminish yourself." Emma nodded, but inside there was a storm. The shift continued, and as always, the hospital swallowed the event and turned it into a whisper, a rumor, a story told in corners. Nurses came to look at Emma sideways with a new curiosity, some with respect, some with envy, some with that distance of someone who fears the brilliance of others. At the end of the day, Emma was called in to cover for a patient in the surgical ICU, General Hargrove. She entered the room accompanied by a security agent who stood near the door. The room was silent, full of equipment, but more organized than the emergency room. The general was lying down, pale, with tubes and bandages, but awake. When he saw Emma, he smiled slightly. "Angel," he said, as if it were the most natural thing in the world. Emma closed the door slowly. "I preferred Emma." The general let out a weak laugh that turned into a grimace of pain. "Fair enough. Emma, how are you?" "I'm working," she replied, leaning in to check his vital signs. "And you? Any pain?" "Pain is an old friend," he replied, his eyes shining. "But I am alive, and that is a gift." Emma checked the drain, adjusted the IV fluids, and observed the breathing. The lung was expanding better. "You shouldn't have stood up," she said, trying to maintain a professional tone. No." He looked at the ceiling for a second. "But I've seen a lot in my life. I've seen men die in seconds. I've seen people crushed by blind systems. And I saw you today being treated like a disposable part. That angered me." Emma pursed her lips. "I'm used to it." "It shouldn't be," the general replied. "Getting used to being despised is a way of dying slowly." Emma remained silent, fidgeting with a bandage to hide her expression. She felt the weight of the sentence. She had lived for years, dying slowly without realizing it. The general watched her for a moment. "Why did you leave?" Emma froze. "What do you mean?" "From the army." Emma swallowed. The agent at the door looked like a statue, but she still sensed his presence. I ended my contract." "And?" The general nodded as if he didn't need details to understand. "I read your name in the Coast report. I remember you, but I didn't know your whole story. I looked it up later. You received a decoration, a bronze star with a V. And then, soon after, you disappeared." Emma closed her eyes for a second. The word disappeared hurt. "I didn't want medals," she whispered. "I know. You never wanted that. You wanted people to go back home." Emma felt her throat tighten. "I failed," the general frowned. "Failed." Emma took a deep breath, and the memory came like a wave. An outpost under attack, a wounded man who seemed stable and then suddenly wasn't. Her hand pressing down, blood escaping, the boy's gaze fading. "I did everything right," she said, her voice faltering. "Everything, and he died. And then I couldn't go back to being the same. I didn't want to be the person who was good at watching people die. I wanted a normal life." The general was silent for a moment. "Do you think there is such a thing as normal life after seeing what you've seen?" Emma did not respond. "Emma," the general said more softly, "you're not good at watching people die. You're good at fighting to keep them from dying. And sometimes, despite everything, they do die. That's not a failure. That's reality." Emma felt the tears finally welling up, hot. She turned her face away, ashamed. "Sorry," she murmured. "Don't apologize for being human," the general replied. "Do you know what I saw on Coast? I saw a little girl with dust on her face, holding a soldier's chest and telling him he couldn't leave. I saw courage. Not the courage to shoot, the courage to stay." Emma took a breath, trying to compose herself. "And today," he continued, "I saw the same courage. You spoke when everyone else preferred silence. You acted when your ego told you to wait. That's rare." Emma wiped her face with the back of her hand. "I didn't want any trouble." "I know." The general smiled slightly. "But confusion is part of change, and I want you to do something for me." Emma looked up. "What? Don't hide." Emma let out a short, bitter laugh. "It's easier that way. It's safer," he corrected. "But it's not living. I'm leaving here. I'm going back to my job, and I want you to stay here. I want you to become a role model, to train people, to teach Caldwell to listen if he's humble enough." Emma raised an eyebrow. "That's asking too much." "You think so?" The general sighed, grimacing. "You know what the problem is with places like this hospital? They get caught up in titles and forget about people. You remember people. Don't lose sight of that." Emma glanced at the monitor, trying to avoid his gaze. "You speak as if you know me." I know the kind of person who saves lives without needing to be seen, he replied. I've seen many, and I've seen what happens when they're crushed by noisy people. I won't watch it again if I can avoid it. The officer at the door cleared his throat discreetly, remembering that time was running out. Emma checked her watch and took a deep breath. I'll think about it. Think fast, the general said, his humor returning slightly. The world is good at stealing time from good people. Emma smiled slightly despite everything. You seem healthier than you should be, considering everything. I have a persistent team, he replied, and a stubborn nurse. She felt something inside her relax, a tension she carried like armor. Perhaps that was it. Not to become a symbol, not to become a legend, but to allow someone to recognize the real person behind it all. When Emma left the room in the hallway, she found Caldwell leaning against the wall, arms crossed, staring at the floor. For a second, she thought about walking straight past, but he spoke. Carter. She stopped. He looked up, and there was something less arrogant about him, something almost uncomfortable. I didn't know. You didn't ask, Emma replied without harshness. He nodded as if admitting defeat. I was wrong about the pneumothorax. You were right. And I was an idiot. Emma was surprised by the blunt honesty. She had expected sarcasm, not this. Caldwell continued quickly as if it were easier to speak without breathing. I graduated from Harvard. I did my residency at Johns Hopkins. The whole world told me I was brilliant. And sometimes I forget that brilliant doesn't mean infallible. Today, you reminded me of that in a humiliating way. Emma watched him. She felt no pity for him, but neither did she take pleasure in his downfall. I didn't mean to humiliate you, she said. I know. He ran a hand through his hair. But it happened. And looking back now, I killed a general for not listening to a nurse. This will haunt me. That's good, Emma said, and saw his expression harden. She raised her hand, not in a cruel way, in the sense that awe is what makes us better if we don't run from it. Caldwell swallowed. You talk like someone who's seen things. Emma nodded. I saw. He fell silent. Then he said more quietly, Thank you for speaking and for acting. I should have said that. Emma breathed, feeling that the conversation was a small earthquake within the rigid world of the hospital. You're welcome. Caldwell hesitated, as if wanting to say more. If you want, I can help formalize your role here. Training, protocols, maybe another role. No need, Emma interrupted gently. I don't want to be promoted for show. I want to be recognized for my work. And I want you to listen to the next new nurse before a general has to shame you. Caldwell let out a short, humorless laugh. Fair enough. Emma walked down the corridor, feeling the exhaustion fall on her shoulders like a wet blanket. But amidst the exhaustion, there was a strange sensation, lightness. At the end of her shift, she went to the locker room, changed out of her uniform, and stared at her reflection in the mirror. She looked like the same old Emma. Brown eyes, dark circles under her eyes, an ordinary face. But something had changed. Not in her face, inside. She pulled the crumpled army card from her pocket and unfolded it. The lettering seemed clearer than before. She ran her finger over the stamp and, for a moment, felt no shame. She felt history. When she left the hospital, the sky was orange, and the Washington cold stung her face. Emma walked to the parking lot, breathing in air that smelled of winter and gasoline. The next day, when she returned to work, something was different. People greeted her with more attention. A young resident, the same one who had laughed in the trauma room, approached her with a red face. Nurse Carter. Try. I wanted to apologize. I shouldn't have laughed. I didn't know, and even if I hadn't known, it was ugly. Emma looked at her and saw fear. Not fear of her, fear of her own mistake. Thank you for saying that, Emma replied. Learn from it. That's all that matters. The resident nodded, relieved, and walked away. Later, Brenda called Emma into the station. You've been selected to participate in the Trauma Protocols Committee, she said, as if she were reading a sentence. Emma blinked. Me? Yes, Caldwell asked for your name. I almost fell out of my chair. Brenda smiled, for the first time truly. It seems a general can work miracles. Emma sighed. I don't know if I want this. You want to be heard, Brenda said simply. That's the way to go. Emma thought about the general's request. Don't hide. And for a moment she felt fear. To be seen meant to be a target. It meant that the memories could also be seen. And she was so afraid of them. But that morning, a man came into the emergency room with his son in his arms, desperate, saying the child wasn't breathing properly. Emma rushed in, assessed him, opened his airway and calmed the father. The child improved. The father cried and thanked her, his voice breaking. And Emma realized that was the only thing that ever mattered, being there when someone needed her. On the third day after surgery, the general was discharged for supervised recovery. Before leaving, he asked to see Emma again. She entered the room, and he was sitting on the bed looking more flushed. I'm leaving, he said. I know. He reached out his hand, and Emma took it carefully, feeling the strength that still existed there. I don't know what you believe, the general said, looking into her eyes, but I believe that the right people appear at the right time. You appeared to me twice. I won't forget. Emma breathed, feeling the weight and heat of the sentence. Me neither. I'm going to send an official letter. To the hospital, he said. Not a threat, an acknowledgement. I want it on record that Nurse Emma Carter was essential to my survival. Emma's eyes widened. General, this... I know, he interrupted, smiling. You hate it, but it's not about you liking it. It's about the world learning, and it's about protecting you. Emma swallowed. Thank you. He nodded. And Emma, seek help, not out of weakness, out of respect for your own life. Emma closed her eyes for a second, and when she opened them, the decision had been made. I'll go, she said. The general smiled, pleased. Good, because the country needs you whole, not just functioning. When she left, she found Caldwell in the hallway. He looked tired with dark circles under his eyes, less than perfect. He watched her for a moment. Are you going to the committee? I will, Emma replied without enthusiasm but firmly. He nodded. Great, and if you call my attention to it again, I'll try not to laugh. Emma raised an eyebrow. Try listening first. I'll try, he said, and for the first time he seemed sincere. The following weeks brought new routines. Emma began participating in case discussions. She spoke at meetings. She corrected residents when necessary. And sometimes she felt the old urge to disappear. But then she remembered the general rising in pain and saluting, not for the medal, for dignity, on a particularly difficult night, after losing a patient despite all her efforts, a young man, motorcycle accident. Emma pulled out to the parking lot and sat in her car, trembling. Tears welled up. She remembered the valley, the 19-year-old boy. She remembered the weight of failure. But, for the first time, she didn't try to swallow it all alone. She picked up her cell phone and called a number Brenda had written down on a piece of paper, a therapist specializing in trauma for healthcare professionals and veterans. When the voice answered, Emma spoke in a whisper. My name is Emma Carter. I need help. There was a silence on the other end, not of judgment but of attention, and Emma felt for the first time in a long time that perhaps there was a path where she didn't need to be an angel or a shadow, just a person. At St. Catherine's, egos still existed, hierarchy still existed. There were still easy laughs and veiled contempt, but there was also something new, a precedent, a wounded general who stood up and saluted a nurse, reminding everyone that saving lives has no fixed title and that courage can wear a uniform, a lab coat or blue scrubs. And Emma, the new nurse who had been the target of mockery, now walked the corridors with the same posture as always, discreet, focused, but with an invisible difference. She no longer carried the past as shame. She carried it as part of her, and when she needed to speak, she spoke, because in the end, it wasn't the restraint that changed everything. It was the choice not to remain silent when someone's life depended on it. And that choice Emma knew she would repeat as many times as necessary, even if the world laughed, even if the world tried to diminish her. And somewhere between beeps and white lights, between trembling hands and steady hands, Emma began to rebuild herself, not as a legend, not as an angel, but as someone who finally accepted that being good at what you do is not a reason to hide. It's a reason to keep going.